In your morning medical news, a disturbing warning from the World Health Organization. They say that polluted air is now threatening 99% of the world's population. The health agency says air pollution kills nearly 7 million people every year, making it the second deadliest health risk worldwide. UNICEF warns that the solution, air purifiers, still remains out of touch for many.
It's the children whose families are living in poverty, who can't afford clean cook stoves, who can't afford masks, who can't afford air purifiers. They're the ones that are paying the price for the air pollution crisis. And these children are paying the price with their health, with their education, and with their very futures. And we need to do better.
Currently, more than 6,000 cities in 17 countries are actively monitoring air quality. And we're on track to see the most intense flu season the U.S. has had in at least 15 years. While other viral infections could be mistaken for flu, experts say doctors' office visits driven by flu-like symptoms are way up, and the virus has even forced schools in some states to shut down. Mandy Gaither takes a look at the latest flu data and how to avoid all of these seasonal viruses.
For a second time this season, flu cases are climbing. So far, the CDC estimates there have been at least 24 million flu illnesses, 310,000 hospitalizations, and 13,000 deaths, including at least 57 children.
If you look at cases overall, it's the worst in many, many years.
43 states have reported high or very high flu activity in the last week. Nationwide, more than 30% of flu tests are coming back positive, and this season you can also test for flu at home.
We weren't able to do that. You could do COVID tests in the past, but now there's a 3-in-1 flu test.
U.S. health officials recommend the annual flu vaccine for everyone 6 months and older. About 44% of adults got flu shots this winter, the same as last winter. But coverage of children is way down at about 45% this winter. It's usually around 50%. Experts say it's still not too late to get vaccinated for flu.
Now keep in mind, if you get a vaccine, it takes about 2 weeks to actually get the immunity from the vaccine, for those antibodies to build up in your body.
To protect against all seasonal viruses, doctors say to avoid touching your eyes, nose, and mouth because germs can spread that way. Wash your hands with soap and water, clean frequently touched surfaces, and avoid close contact with people who are sick.
Experts say if you have flu-like symptoms, it's a good idea to get tested. Knowing if you have the flu can help slow the spread, but also help those who are at higher risk of severe illness because certain antiviral medications can be taken in order to shorten the duration of those flu symptoms.